Afternoon. We are delighted to be joined by our friends and colleagues from UNFPA. To my immediate left is Leyla Sharafi, the Chief of Gender and Human Rights Branch at UNFPA. And next to her is Emilie Filmer-Wilson, the Human Rights Advisor for UNFPA. They are both here to brief you on the state of the world's population report. Leyla, please.
Thank you so much. Thank you so much. Is this on?
Yeah,
Yes.
go ahead.
Okay, great. Thank you so much for joining us today on the launch day of this year's State of the World Population Report titled Interwoven Lives, Threads of Hope, Ending Inequalities in Sexual and Reproductive Health and Rights. This report highlights an unfortunate truth. The progress we have made in sexual and reproductive health and rights over the past 30 years has not been enjoyed equally, and we need to shift our strategies if we are to achieve the Sustainable Development Goals by 2030. The SDGs were launched in 2015 to improve the standard of living for millions of people, reaching the furthest behind first. But halfway into the SDGs, we have found that marginalized groups are still struggling to access even basic sexual and reproductive health services. The harsh reality is that socioeconomic status, ethnic identity, race, sexuality, and disabilities, among other factors, too often determine whether a person can live a safe and healthy reproductive life. This is a global trend, but it requires national solutions led by governments. We are seeing vital healthcare statistics, for instance, maternal mortality rates stagnate and in some cases worsen due to inequalities within countries. In fact, since 2016, there has been zero progress in the annual reduction in maternal deaths, and 13 countries have seen rollbacks in women's ability to exercise bodily autonomy. This concerning trend applies to countries across the economic spectrum. Even in relatively wealthy nations, such as the United States, we see failures in medical care for Black women who are 3 times more likely to die giving birth than their white counterparts. This is not a problem with a one-size-fits-all solution. Each marginalized group in every country has unique sexual and reproductive health needs, many of which are currently unmet. In indigenous communities, women struggle to find doctors or midwives that speak their language or understand their cultural birthing customs. Those living in poverty can find it impossible to afford quality, consistent medical care. And people with disabilities, who face discrimination nearly twice as frequently as those without disabilities, can face accessibility barriers that prevent them from getting to hospitals and other services. Women and girls with disabilities confront even greater barriers and reproductive rights violations. To start addressing the healthcare needs of these diverse communities, we must face the core issue. Our societies are rife with structural problems that keep these groups on the margins. We have inherited and propagated systems that were created without the well-being of the most excluded in mind, from colonial-era laws that persecute the LGBTIQ+ populations to histories of discrimination on the basis of gender, race, and sexuality. Luckily, there are solutions at hand. First, investment. Our calculations show that an additional US $79 billion investment in low and middle income countries could prevent 400 million unintended pregnancies, save 1 million lives, and generate $660 billion in economic benefits by 2030. As with any reform, we understand that there may be substantial initial expenses in reaching the most marginalized. However, the returns on this investment far exceed the costs. Second, the key to breaking this cycle of vulnerability lies in data. There's widespread gaps in disaggregated data that would inform and lead to better policies. Before we can reform our health and social structures, we must understand their impact on marginalized groups. This requires understanding who they are, where they are, and what they need. Third, we have to account for marginalized groups in our solutions to all of the world's challenges, whether that's climate change, conflicts, or demographic changes. Marginalized people are regularly the most impacted by these issues, and they should be at the forefront of our efforts. The message is clear. We've made progress over the past 30 years, with maternal mortality down, access to family planning up, more attention to gender-based violence, but we now need to focus on the harder to reach so that progress impacts everyone. We know the benefits that come from improving access and norms around sexual and reproductive health care. Now is the time to start working from the bottom up. In the coming decades, let us measure progress, not by the gains afforded to those easiest to reach, but by the ability to lift up everyone, no matter who or where they are. I thank you.
Thank you very much. We'll take some questions. Gabriel?
Thank you very much for your briefing. My name is Gabriel Elizondo from Al Jazeera English. I'm asking the question on behalf of the UN Correspondents Association. You spoke a lot about, first, thank you for the briefing. You spoke very much about data and widespread gaps that are occurring and how figuring out what these widespread gaps are is key to advancements. Were you able to look at all in a comparison of countries with privatized healthcare, such as the U.S., vis-a-vis free universal healthcare countries? And if you are, can you speak to that on how any more information you might have on that in the context of the report and your findings? Thank you.
Please, no, go ahead.
Thank you. So this report talks a lot about the data. That is one of the key challenges, and it's an issue that all countries face. This week, where we also, it's the week of the UN Permanent Forum on Indigenous Issues, talking about Indigenous peoples. When we were doing analysis, we only found 8 countries that disaggregated data for Indigenous women on maternal health outcomes. So we cannot track the progress and the vast disparities if we don't have the data. We haven't looked specifically at the different forms of whether that healthcare is provided in privatized systems or not. We look at the overall health outcomes in the country. And data is one of the key problems, rendering those that are, keeping those that are invisible in the shadows. And we're trying to bring them out, make them visible so we can better target them.
Thank you. Yvonne?
Thank you very much for this briefing. Yvonne Moriarty, News, Ireland's national broadcaster. You singled out the United States when you were giving your briefing. Presumably you were doing that to draw attention to the current debate in this country. But can you expand a little bit on the impact that the change in legislation has had on the outcomes that you discussed, and particularly with regard to marginalised communities? And where do you think this is heading now? Given the elections are coming up this year, and what lessons do we need to draw as a global community from what's going on in this country?
Yeah, thank you so much for this question. I mean, I think in terms of reproductive rights legislation, and particularly abortion, I mean, national governments determine the medical procedures that take place in their countries. What we can say, and what we will say about this specific issue, is that where abortion is legal, we say it should be safe and accessible. Post-abortion services, however, must be available no matter the legal status of abortion. One thing that UNFPA is vocal about is that we have to acknowledge the facts, and this is something that is very important. Evidence shows that unsafe abortion is a leading contributor to maternal death globally, and overall abortion rates tend to decline only in countries where it is broadly legal. But to bring it back to lessons, bring it back to the report and to your question about what we can learn, the report very much focuses on, and as I said in my statement, that marginalized women are particularly impacted by restrictions, lack of access, and barriers. So really, I think, that's really the lesson here, is that whatever happens in a particular country, it is the women who have or living in the context of poverty, or they're indigenous, or with disabilities, refugees, IDPs, any other factor, they're really the ones that are going to be most impacted, and that's what we really have to keep our eye on, regardless of what is happening in a country in terms of legislation.
Thank you. Errol, please.
Arun Lewis from Innovation News Service. I'm not sure whether this is within the ambit of your report or not, but looking at the report, you see wide disparities in the total fertility rates. What impact do you think these disparities have within states on the health of women, and also the impact that it will have on the global demographics, and also the future of the SDGs? Thank you.
Do you want to take it?
I can take that
Okay.
one. I think that's a really great question, and this report looks at some of the the global threats and trends and how they impact the area of sexual and reproductive health rights. Demographic transitions is one of them. So with countries with falling fertility rates, we're seeing in particular elderly women who have largely been invisible and not addressed to the attention that they need to be really impacted in those countries. And at the same time, the policies that are being promoted in countries to strengthen fertility rates, we're working with governments to ensure that they are gender and human rights based, so that they are promoting rights at the same time as addressing the changes in demographics. So we're seeing vulnerabilities change depending on the different demographics that the country faces, and we need to be attuned to new populations, different populations that are going to be most impacted by these changes in demographics, such as elderly women.
Thank you. Yep, please.
Hi, it's Eric with Kyoto News. So it's a Japanese news agency, and I looked through your report, and I noticed there's a discrepancy with regards to your numbers, the Japanese population, and the official numbers from the Internal Ministry. So if you could explain how you arrived at those numbers. And then in addition, how do you assess Japan's progress with regards to these marginalized groups that you've been talking about? Thank you.
Thank you for pointing out that issue. We'll definitely look into that and have to get back to you, particularly on the discrepancy in data that you mentioned. I think that, your question about Japan, I think all countries, and this is related to the question on demographic changes. I think there are definitely concerns in many countries about some demographic changes. And I think one of the things that we certainly are saying in the report, that despite these demographic changes, which I know is on the minds of many countries, including Japan, whether it's aging, a boom in young populations, migration, or perceived threats of population decline or low fertility, which is leading some policymakers to really push back on what we call the ICPD values, which is putting human beings and choices at the center, is really concerning. But I think at the end of the day, what the report is trying to point out is, despite the demographic changes that might be happening, and we are living in a very diverse demographic situation than we ever have been before, we put human rights and gender equality at the center.
Thank you. Gabriel?
Thank you. One quick follow-up. Did I hear you correctly that say that only 8 countries track Indigenous women's health care statistics?
Yeah, I can clarify that question. We did an assessment back in 2008, and we found that from something called the DHS survey, the Demographic Health Survey, and only 8 could be disaggregated, were disaggregated by indigeneity and published. So more countries had disaggregated it, but they hadn't made that data available. We were then able to invest in that, and we got 16 countries that had the data available. And those countries must be commended, because that already shows commitment to supporting Indigenous women's health outcomes. And we can share with you that report if you want the more specific technicalities around that. I also just reminded that we haven't actually shown the report. So this is the report that we are launching today, that we've been discussing this morning.
Leyla, Emilie, thank you very much, and good afternoon to all of you. Thank you.
So much.